Blue states banding together, filing a lawsuit challenging RFK Jr.'s moves to streamline 28 HHS divisions into 15, laying off 10,000 HHS employees on top of the others who voluntarily left at the beginning of the year. Now, this in addition to the big announcement today with the president officially banning the controversial, exceedingly dangerous gain-of-function research. That's what makes viruses more lethal in research settings. Remember, COVID-19 originated in the Wuhan lab, which was engaged in gain-of-function research, partly and directly funded by the National Institutes of Health. Isn't that great? It's insane.
This is an historic day, the end of gain-of-function research funding by the federal government and also controls by private corporations on gain-of-function studies.
It's a big deal. It could have been that we wouldn't have had the problem we had.
A lot of people say that, sir.
If we had this done earlier.
Here with me exclusively is HHS Secretary, Robert F. Kennedy Jr. Mr. Secretary, thank you for joining us. How do we know with this ban, which is long overdue, will be effective given the fact that we know illegal attempts will occur, which makes it even perhaps more dangerous?
Yeah, I want to congratulate you because you were the first person on national TV when you interviewed Dr. Fauci to raise the issue of the link between his gain-of-function studies and what happened in Wuhan with the COVID pandemic. As you pointed out, gain-of-function studies are the kind of science that is designed to make microbes and pathogens more virulent, more transmissible, and more deadly. It was in this country, they started doing it in 1947, the military and the intelligence agencies, in order to develop bioweapons. In 1969, President Nixon banned it all, shut down Fort Detrick, shut down all the labs. That ban, and then signed the Bioweapons Convention. That ban lasted till 2001. And after the anthrax attacks, Anthony Fauci essentially restarted the arms race and the bioweapons arms race, and did it under the pretension of developing vaccines because of the same science that you develop bioweapons and vaccines. In 2014, 3 of his bugs escaped, and 300 scientists wrote letters to President Obama asking him to shut down Anthony Fauci. President Obama declared a moratorium, but instead of shutting down his experiments, he moved them offshore, mainly to the Wuhan lab. And now, the principal institutions of our government, the CIA, the FBI, the State Department, Department of Energy, all say that it is most likely that those experiments resulted in the COVID-19 pandemic beginning in 2019. So President Trump today moved to shut down this kind of research in this country and to stop funding it abroad.
Do you think this is the reason that Anthony Fauci was given a pardon by Joe Biden, and that in some way is linked to this gain-of-function funding?
I don't know what was going on in Joe Biden's head, but I think that Anthony Fauci probably asked for that pardon, knowing that he had some liabilities here that were more than reputational. They were legal liabilities.
A number of my friends who are in medical research, who are conservatives, big supporters of the president, they understand the need to streamline a lot of bureaucracy at HHS. They're also concerned about future federal funding of legitimate and good research projects. Do you have any updates on that, how that people can rest easy that research will continue and it will continue to get some federal funding?
Yeah, and first of all, what we're cutting is waste, fraud, and abuse. We're streamlining an agency that grew by 38% in the 4 years that President Biden was in the White House, and we're dialing it back to the pre-Biden administration. And the agency was not doing what it was supposed to be doing, which is preventing disease, chronic disease, particularly in Americans. Americans during that period got sicker and sicker and sicker. Oh, and the agency is bloated. When I got there, there were 100 communications departments. There were 40 procurement departments, 40 IT departments, 40 HR departments. And we streamlined the agency. We got rid of the redundancy, and that's how we save that money. We're not getting rid of any critical research, and we're not getting rid of any of the programs that are critical to Americans' health care.
And the gender-affirming care, there's a big controversy, obviously, about that. Can you tonight give us any updates about federal monies ever going toward that? I won't even call it medicine with young people.
Yeah, I mean, we've complied with the executive order and banned all federal money, all HHS money toward gender-affirming research or toward surgeries that are essentially mutilation surgeries.
Obamacare, most people feel, has just turned into a complete disaster for the healthcare industry. Are there any potential revisions to Obamacare that will be possible with this narrow majority in Congress?
Well, it's hard for me to predict what Congress will do. We're doing a lot of things in HHS right now to make our delivery of that care more efficient. And there's probably about $159 billion worth of fraud that has not been detected. And we are using AI with the help of Elon to actually go out and detect that fraud and to end it. So we're going to be able to, again, streamline the systems that we do have, even if we never get congressional intervention or help. We're going to be able to make the agency much more efficient than it's been in the past.
And you think it'll be permanent? These changes ultimately will be permanent?
I can't guarantee that.
That's hard without Congress. You may have seen this over the weekend. New York Democrats, your old friends, Chuck Schumer and Kristen Gillibrand, blasting what they called a cruel effort to dismantle a 9/11 health program, talking about more cuts from HHS. This is kind of typical. They do this with Trump as well. You're stealing Christmas. You're taking the dolls from the kids and the train sets because of the tariffs. But now it's cuts to those critical programs. Your response to them? They think it
President
resonates.
Trump has not cut the 9/11 program. We took that program and we took a lot of OSHA. And there was also a lot of complaints that we ended OSHA, but we've just consolidated that in a new sub-agency called the Administration for Healthier America. Well, those programs were not terminated as the media has reported, but they've simply been consolidated into a place that makes more sense.
Are you surprised about the Democrat Party, kind of where it is today, clearly at a crossroads?
I'm obviously surprised because I ran as a Democrat originally. And the Democratic Party that I grew up in does not exist anymore. The party I grew up in was the party of peace. It's now the party of war. It was the party of speech freedom and constitutional rights. It's now the party of censorship. It was the party that promoted women's sports. My uncle, Ted Kennedy, wrote Title IX and considered women's sports sacrosanct. And today, the Democratic Party is trying to dismantle Title IX. And I could go down a long list, but it's, as you know, it's very, very odd that President Trump is not only dictating the agenda of the Republican Party, but he is also dictating the agenda of the Democratic Party. They only have one issue, and that is we hate Donald Trump. You know, for many years, the Democrats were against NAFTA. And as soon as President Trump said, I'm against NAFTA, the Democrats became pro-NAFTA. And that is true across the board. So I hope in the future the Democratic Party start working on an agenda to help the middle class, to help the American public. But right now, that's entirely the purview of, of President Trump's agenda.
Well, the Democrats are saying now that you're trying to create a database of autism patients to track them and to watch them. And they're using that as a real inflection point in this very critical debate about why we have so much autism in the United States. Your reaction or response to that charge?
Well, you know, one of the problems that we've had at CDC and NIH and FDA has been a kind of data chaos, and particularly around the issue of autism, where not only do they not understand, and they can't tell us the etiology, the origins of why are we having an epidemic, but they deny an epidemic exists. And even though every year the numbers go up, we've gone in 1 in 10,000 in 1970 to 1 in every 31 kids today. In California, which has the best database, it's 1 in every 20 children, 1 in every 12.5 boys. This is an existential disease. Every other disease like this has a registry, and it's voluntary. the public health officials can monitor the numbers. It's not private information. It's not information that is going to go out to other agencies. It's a voluntary system where your privacy is protected. Just a system for keeping track of a disease that is now becoming debilitating to the American people.
Well, we need that. We need that for COVID, vaccine injuries, all of this. Mr. Secretary, you're tackling a lot at the same time. No wonder they're filing so many lawsuits against you. Thank you so much. Great to see you. Thanks for coming in.
Hey, Sean Hannity here. Hey, click here to subscribe to Fox News YouTube page and catch our hottest interviews and most compelling analysis. You will not get it anywhere else.